We move on to the next speaker, Professor Emma Porio. Professor Emma Porio will kindly give a presentation on the case of the Philippines, especially focusing on climate and the city. So I hope we will see her, Professor Emma, a beautiful face in a few seconds. Oh yes, now Professor Emma is with us.
Okay.
So,
good morning, everyone.
good
I would
morning.
like to thank the previous panelists also yesterday who had outlined the landscape of the COVID impacts and how it is affected by climate. I would like to thank Professor Teparat and Professor Wilson for basically laying out the COVID impacts to health and to the city. So the title of my presentation is COVID-19, Climate and the City, Challenges to Recovery and Resilience.
Okay.
All right, the presentation I'm going to give today will consist of 4 parts. Briefly, I will look at the national and international context because the previous speakers have laid them out excellently. But I'll go into the community context, the impacts of the COVID and climate on the poor and the vulnerable groups. And then the last 2 parts, I'll focus what I call the science technology pathways to resilience, which I think as academics, as researchers in the universities, must contribute to the solution by looking at our science and our scientific practices in partnerships with the private sector, the communities, the local governments, and focus also on the community initiatives. The last part, basically, I'd like to look at what I call the science technology in the service of society to care for our common home. So briefly, basically, you can see the COVID-19 cases as of October 2020. Yesterday, I was very envious of the presentations of Japan and Vietnam and for their excellent prevention and mitigation performance. So normally, the cities of the global south are already challenged with population expansion, densification, rapid expansion of the economy, pollution problems, traffic congestion, and social services deficits and the like. In the Manila, we have been on lockdown since March 16, and we are now in the 7th month. In June, in May, late May and June, the monsoon floods and rainy seasons came. So you can see here on June 3, 2020, the headline of the BBC News says, Cyclone Nisarga, storm set to hit COVID-19 ravaged Mumbai. At that time, Mumbai had 50,000 COVID cases in a 20 million population, and the hospital beds were shared by patients that have to be evacuated. And with heavy rains and big storms and big tides, also comes gastrointestinal diseases, dengue and leptospira. So basically, the storms and the floods highlight the vulnerabilities of the health and risk governance systems and the vulnerabilities of the poor. You can see here also on June 2, the NHK World Japan headlines, coronavirus complicates preparation for typhoon season. And really, this is a case that I call biological hazards, like COVID collides with climate hazards and can result into cascading disasters. So you can see here in Hobby was a COVID hotspot, and in June, July, the big floods really came. And you can see there the impacts of the damage and the displacement of people because of the floods as well as the COVID. In India and Bangladesh, Cyclone Samphan destroyed houses, buried a lot of houses also because of the landslides, and it basically made the response to COVID pandemic more complicated, and it demanded more increase in evacuation centers and the like. So in the Ecuadorian Amazon, the flooding destroyed houses, and also it increased hunger and food insecurity because they have to go down the river to get food supply in the nearest center. So also they have hard time getting medical support. In the Philippines, in late May 2020, we had Typhoon Ambo, or Bongpong an international name. And at that time, we only have 11,600 infections. And you can see now we have over 300,000. But really, it displaced a lot, over 300,000 people in regions 5 and 8. And it doubled the number of evacuation centers needed, who were also used as quarantine facilities, taken down because of the strong winds. So basically, you can see here the impacts, how typhoons and flooding really complicate the evacuation process, following the COVID protocols of social distancing, hygienic habits, and the other kind of protocol. It's hard, basically. So you consider the evacuation rates and also the COVID. So really what I'd like to say is that COVID-19, or what call this here in Tagalog, ang pandemya at ang klima, and the poor and the city are. So I would say that I always tell my staff that we have a cascading hazard impacts of climate, and it's really challenging the health and governance systems, and it highlights the vulnerabilities, already vulnerable poor. So, for example, since the lockdown, COVID-19 have affected 1,500 diseases worldwide. In Metro Manila, the high population densities have complicated the evacuation and also prevention efforts, because the COVID-19 hotspots in Metro Manila are usually also the flood inundated areas. And the evacuation centers have low supply of food, sanitation, face masks, and in fact, in one case, the Metro Manila Development Authority, who's in charge of the flood control system, some of their personnel got tested positive, so it caused delays of the pumping station operations. The local, the LRT, the train system, 200 of their employees got infected, and it had to cancel the service of the train of the LRT for 1 week to 2 weeks. So displacement and mobility really affected the population, and it really shows that COVID-19, it reminds us that the increasing urbanization has resulted in the transmission of diseases, zoonotic cases from animals to humans, and that we should look at community initiatives and strong social infrastructures in the community, because the health systems and the governance systems are very much overwhelmed. So this is the story of the relocatee in the seaside of Manila. Basically, they were relocated there in 2019. In 2019, they were victims of Typhoon Kitsana. They were relocated from the Tulihan province in 2017. But lately, during the COVID-19, they were also told to destroy, or at least destroy, the illegal structures at the back. They have put plastic roof and fences and barriers to thieves and floods. But basically, they were told this is illegal, and the people put the fences and the roof to prevent the rains from coming. And if you look there at one picture, the children who were doing online classes had to do it outside, and they were wet by the rain because the signal to the phone was only outside. So I'll go basically to the next slide, saying that what, as shown in the previous presentations of Contiparat and Professor Wilson, really the COVID-19, the pandemic, have heightened the chronic and structural vulnerabilities of the poor. It heightened the weaknesses of the housing and health systems of the city, and it heightens the fragmentation of risk governance systems, national, regional, and local. So I would like to look now at our university and our project. What have we done as engaged inter and transdisciplinary researchers? We have basically decided that as scientists, we have to input and we have to contribute in terms of our science-based initiatives. So we have done basically the climate disaster risk assessment and the social vulnerability analysis that highlight the invisible poor. The poor in the cities are statistically invisible. 40 to 60% of the cities are really informal, and they are not in the formal statistical system. So the distribution of the social assistance program is challenged because they do not appear in the statistics and the profile of cities, which shows who are the poor and who should be assisted. So we've also done technologies for climate and disaster resilience, like the solar-powered potable water systems, the automatic hand washing facilities for barangay health centers. We've partnered with several barangays for that. And then with the web-based, this is a major partnership. We have the National Resilience Center, what we call the web-based Geospatial risk data system for COVID risk management, in partnership with Stadio University, Epimetrics, and of course, Ateneo de Manila and the National Resilience Council, the main mobilizer. So you can see here basically saying that the invisible poor really are invisible in the statistics and the records. But if you look at a map in our climate disaster risk assessment maps, wherein we have the social vulnerability analysis, locating the poor where they are, and what are the climate hazards that they are subjected to, as well as the political and economic and social hazards. You can see here, this is an example of how we have, based on our climate disaster risk assessment, we partnered with Epimetrics and the other universities and the National Resilience Council in trying to come up with this geospatial risk database for COVID-19. So this is an example. We started in June 16 on training the local climate, the local chief executives and planners and city health offices, and trying to lay out the landscape of their climate hazards as well as where the epidemiological hazards are located. So you can see here the Ateneo Innovation Center, I was mentioning earlier. Also in terms of the digital portable library, as well as the the testing of the low-cost ventilator, because the ventilator costs over sometimes from 300 to 500,000. But here, this one that the Ateneo Innovation Center fabricated, it's really just less than 50,000. So I'll just, I've mentioned already the web-based geospatial risk database system, because the government really, the database system of the government is quite challenged, and also in making the poor visible. And then also the Manila Observatory regularly issue what I call context-informed typhoon advisories. For example, we are entering a mild La Nina, and so that is what Manila Observatory is saying. So I will basically conclude now by basically saying that the COVID-19 and the climate hazards really forces us to recast and examine the new pandemic-generated inequalities and poverties. It stems from the fundamental inequities, rural, urban, gender, generation, geography, and the geographies of resource bases and power. So we basically think that our job as scientists, we have to put the evidence out there so that the poor becomes more visible, the deficits become less, and we basically, you can see the digital divide with the online learning now has also widened. So I always say in our program, we have to innovate, but to innovate is to collaborate, but to innovate is also to navigate across systems of power and action. So we should also focus that while there is solidarity upstairs, there's also solidarity networks of LGUs, communities, and the poor. And we should focus on this in terms of what I call in my, with my colleagues, that we should be problem focused and solutions driven with the systems lens. We look at with the people and the policymakers and the scientists as basically collaborators in providing creative solutions. So let me basically conclude by saying my message really to the community of scientists and policymakers and practitioners, that we should band together to construct human security and resilience through our positive creative, proactive actions using our own expertise and science. So I'd like to close this presentation by quoting Hildebrandt when he said, "A true community is not just about being geographically close to someone or part of the same social network. It's about feeling connected and responsible for what happens. Humanity is our ultimate community, and everyone, from the top to the bottom to the middle, plays a crucial role in contributing to our solutions." Thank you.